be showing proper technique for insertion of a Foley catheter into a male patient. I reviewed my order, made sure exactly what I had to do, and I checked to see if the patient had any allergies, specifically to iodine or latex. And then I gathered my supplies, came into the room, identified myself, and identified my patient, asked him his name and his date of birth, and also checked his name and date of birth on his name tag. I explained the procedure to the patient, asked him if he had any questions regarding it, and he did not. So then I would provide proper hand hygiene, and also will raise my bed to a comfortable and safe working position. I'm going to put on gloves. And putting gloves on in order to clean the perineal area. We're going to expose the patient. We're going to clean the perineal area with soap and water and dry thoroughly. The same would go for a female. We'd also clean her area with soap and water. So then we're going to remove the gloves and discard. And we're going to go ahead and put him in a position to do the procedure. Okay. Next, we're going to create our sterile field. When opening this, we're careful to grab the 1 inches of the corners. Pull down, maintaining the sterile field. This drape also needs to be grabbed at the corner. Let it fall apart. We don't want to shake it too much. And we're going to put it shiny side down, drape under the patient. For a male, we want to try to cover up his thighs. For a female, we want it under her bottom. Okay. So next, we'll put on our sterile gloves. Careful to grasp just the inside of the gloves and only touch the inside of the gloves when putting it on. This one, we're going to go underneath the cuff. Put on the sterile gloves. For the female, the lubricant, we want to open it up and put some in the tray. The male's lubricant, we just want to go ahead and get the lid off of it. Have that ready to go. We want to go ahead and saturate our cotton balls with the iodine. Go ahead and take the cap off of our saline. To the port, making sure that's secure. Okay, we're going to bring this over here towards the patient in order to cleanse the area. So with our iodine soaked cotton balls, first we're going to grab the penis, and we will no longer be able to use his hand. It's now considered non-sterile. For a male, I will pull the foreskin back and clean in a circular motion to the meatus, discard. A second cotton ball, going to clean around the glands in a circular motion and discard. And a third one, going to clean more of the shaft in a circular motion and discard. For the female, I would pull back the labia, clean the outer with 1 cotton ball, and outer with a second cotton ball, and then the inner with the cotton ball going from top to bottom on the female. be discarded. Okay, next thing we want to do, tell the patient we're getting ready for the catheter insertion, and go ahead and relax. We're going to be inserting the lubricant. We will use all that is in the syringe. This is 10 mils. We would put all of it in there and discard. Bring the catheter to the bed towards the patient here. For a female, we would dip the tip of the catheter into the lubricating gel. And for either male or female, we would ask the patient to take a deep breath and relax. And we would begin the insertion slowly and gently, checking on the patient, make sure they're okay. For the female, we want to insert until we see a little bit of urine return, and at that point we would insert another 3 inches. For a male, we want to insert all the way to the wide bifurcation, which we're there. I want to hold on to that. Insert all 10 mils of the saline solution to inflate the balloon. Okay. We can remove that and discard. We want to pull out gently until we feel a little bit of a tug or a pull to know that the balloon is in place and inflated, and it is. Okay. So then we can take off our gloves. We want to dry the area and make sure that it's all dry. And then we're going to attach the catheter to the patient's leg with either a tape or a leg band, whichever the hospital calls for. The bag needs to be hung on the side of the bed. Needs to make sure it's below the bladder. And then we're just going to clean up. Ask the patient if he has any questions or concerns. Make sure he is not in any discomfort or pain. Put him back in a comfortable position. Cover him up. Provide for privacy. Lower the bed. Make sure his call light is within reach. We're going to document and wash our hands. The end.